there, my name is Bruna. I'm a registered nurse. How are you doing
Perform
today?
hand hygiene while entering the
I'm here to
patient's
conduct
room.
an assessment with you. Is that
Introduce
okay?
yourself and ask
Before
for
we
your
begin,
patient's
I'd
full
like to
name and
confirm
date
your
of birth.
first name, your last name, and your birthday.
Make sure this matches the patient's chart.
Thank
If in a hospital setting, verify the accuracy of the name and date of birth with the patient's ID bracelet. Make sure you have gathered all the relevant information needed before starting any physical assessment. In this case, a full or focused health history would have been performed, including an OPQRSTIUA for the presenting symptom if indicated.
Excellent.
Today, the patient presents with no health issues. It is an initial visit requiring a complete physical examination with no particular specificity. Explain to the patient the assessment you will perform. In this case, that you will be performing a comprehensive head-to-toe assessment. Tell them that you might be asking additional questions, listening to their chest and abdomen with your stethoscope, and asking them to perform different movements. Always let your patient know that they have the right to refuse at any point and ask for their consent to continue. All physical assessments need to be done directly on the skin, whether you are inspecting or palpating. For the purposes of this video, some assessments may be done over clothes. Always make sure your patient is comfortable.
Excellent. All right.
First, start with the general appearance. Look at your patient's facial expression. Note if it is appropriate for the situation. In this case, the patient's facial expression is neutral. Look at the body position. Note whether it is relaxed and comfortable or tense and in pain. The patient appears relaxed and comfortable. Assess the level of consciousness. Note whether the patient is alert and oriented to person, place, and time, attentive to your questions, and responding appropriately. This patient is alert and oriented to person, place, and time. Inspect the skin color. Determine whether the tone is even and consistent with ethnocultural heritage. In this case, no redness, no pallor, no jaundice or blue aspect of the skin is noted. Next, we will be taking measurements. Measure baseline vital signs: temperature, pulse, respirations, and blood pressure. Note whether you must avoid an arm because of surgery, mastectomy, IV access, or dialysis shunt. Collect and document vital signs more frequently if patient is unstable or patient condition changes. Measure oxygen saturation. Maintain at 92% or higher, or as ordered. Next, you will be taking the patient's height and weight. Activity. In all settings, note any assistance needed, how the patient tolerates movement, distance walked, the patient's ability to turn, and whether their gait is steady and symmetrical. Note any need for ambulatory aid or equipment. Complete any standardized scales used to quantify the patient's risk for falling and/or functional status, and assess need for referral to physiotherapy or occupational therapy. In a hospital setting, if the patient is on bed rest, the head of the bed should be angled at 15 degrees or higher. If the patient is ambulatory, assist them to a sitting position. Assess for orthostatic hypotension and dizziness. If none, move the patient to a chair. Increase activity as tolerated. Next, we will examine the neurological system. As you will note, certain steps are done simultaneously throughout your assessment. For example, we previously observed the patient's eyes open spontaneously to name when entering the room, and the patient's verbal responses were appropriate. Note any ptosis or facial droop and ask if the patient has any difficulty swallowing. There is none in this patient. Delirium screaming should be included as part of the head-to-toe assessment. Select a validated tool to perform this assessment.
Next, we will measure right and left pupil sizes in millimeters and assess reaction to light. In this case, the pupils are equal, round, and reactive to light and accommodation. Both pupils are 5 millimeters. Assess the muscle strength of the right and left upper extremities using hand grips and flexion and extension at the elbow. Assess muscle strength of the right and left lower extremities, pushing feet against your palms and flexion and extension at the knee. Use the MRC scale to grade the muscle strength in the upper and lower extremities. Compare each side bilaterally. Next, we will be assessing the respiratory system. Assess the respiratory effort and inquire whether the patient is short of breath at rest or on exertion. In this case, the patient is breathing regularly and is not experiencing any shortness of breath. Auscultate breath sounds. Do not listen over the patient's clothes, and compare both sides. Ensure you listen to all lobes, both anteriorly laterally, and posteriorly. For this patient, there is clear air entry bilaterally with no adventitious sounds.
Hospital setting respiratory system. If the patient is receiving oxygen by mask or nasal prongs, check fitting and assess skin integrity of the nares and behind the ears. Note fraction of inspired oxygen. Instruct the patient to cough and breathe deeply. Check color, consistency, and amount of any expectorant. If an intensive spirometer is ordered, encourage the patient to use it every hour for 10 inspirations. If oxygen saturation or respiratory rate drops, encourage its use every 15 minutes. During auscultation, if the patient is not able to sit up, have another person hold patient to each side.
Next, we will be assessing the cardiovascular system. Auscultate the heart at the apex. Note the rate in beats per minute and rhythm, regular versus irregular. Remember, do not listen over the patient's clothes. In this case, the heart rate was regular at 72 beats per minute. Assess the heart sounds in all valve areas. First with the diaphragm of the stethoscope for S1 and S2. And then with the bell for murmurs and extra heart sounds. No extra heart sounds are heard for this patient. Check capillary refill of upper extremities for prompt return. Consider it normal if the color returns in less than 1 or 2 seconds.
Hospital setting considerations. Cardiovascular system. Check for pre-tibial edema. Palpate the posterior tibial and dorsalis pedis pulses in both feet. Assess pulses in the lower extremities by Doppler technique, if not palpable. Assess capillary refill in lower extremities. Verify that the correct IV solution is hanging and flowing at the correct rate according to both the physician's orders and your own assessment of the patient's needs. Check apical pulse against radial pulse, noting perfusion of all beats.
Next, we will assess the patient's skin. Skin color and consistency have already been done while assessing the general appearance. Additionally, note skin integrity or any lesions, tattoos, or piercings. Palpate skin temperature. Expect the skin to be warm and dry. It is the case for this patient. Pinch up a fold of skin under the clavicle or on the forearm to note mobility and turgor. Both are appropriate for this patient.
Hospital setting considerations. Skin. Note skin integrity, any lesions, and the condition of any dressings. Note any bleeding or infection, but do not change dressing until after physical examination. Note the date on the IV site and the surrounding skin condition, observing for redness, edema, discharge, etc. Complete any standardized scales used to quantify risk for skin breakdown. For example, the Braden scale for predicting pressure sore risk. Verify that alternating pressure mattresses being used are properly applied and operating at the correct settings.
Next, we will be assessing the patient's abdomen. During the health history, you would have already inquired about the following aspects: nausea, vomiting, if the patient is passing gas, having constipation or diarrhea, and when their last bowel movement was. Assess the contour of the abdomen. Determine if it is flat, rounded, or protuberant. In this case, the abdomen is flat. Listen to bowel sounds in all 4 quadrants. The patient's bowel sounds are active and normal. Next, perform light palpation in all 4 quadrants, pressing down approximately 1 centimeter. Note the patient's facial expression and ask whether they are having any pain.
Hospital setting considerations. Abdomen. Check any drainage tube placement for color, consistency, odor, and amount of drainage, and evaluate the integrity of the insertion site. Assess all tubes from site to source for kinks, leaks, or disconnections. Check any stoma for color, moisture, excoriation, and bleeding, and evaluate the integrity of the stomal appliance. Check stomal drainage for color, consistency, odor, and amount. In terms of diet, determine whether the patient is tolerating ice chips, liquids, or solid. Note whether the patient is at high risk for nutrition deficit. Genitourinary system. During the interview, the patient was asked about difficulty urinating and frequency and aspect of the urine output. In the hospital setting, it is essential to assess the indwelling urinary catheter and surrounding skin integrity, check color, quantity, and clarity of urine with every check of vital signs. Verify if urine output is less than the expected amount. If so, perform a bladder scan according to agency protocol. Determine whether the problem is associated with the production of urine or its retention. Assess 24-hour fluid balance to identify hydration or dehydration, kidney function, and perfusion.
Here is an example of the nurse assessing the abdomen in a hospital setting. She's asking questions while performing the physical assessment.
So thank you. I finished auscultating your bowels. I'm going to do a light palpation and I'll ask you a few questions as well. If you feel any pain, let me know, okay? So have you experienced any changes in appetite?
No.
No? Have you had any bloating recently?
No.
Okay. Did you have any abdomen pain?
No.
Did you feel any heartburn?
No.
No? All right.
If the patient were experiencing pain or abdominal symptoms, the nurse would have performed a more in-depth assessment of the abdomen, including deep palpation and percussion.
Additional information. A focused health history and a physical assessment can be performed at the same time in a hospital setting. Both subjective and objective data are collected simultaneously using a systems approach, which means that while doing a physical assessment, you would also ask questions to your patient instead of doing it consecutively. Abnormal findings may prompt a more comprehensive assessment of the affected systems.
At the end of your assessment, ask your patient if they have any questions and ensure they are comfortable. If in a hospital setting, ensure the call bell is in place and bring the bed back to the lowest position. Remember to perform hand hygiene after you've completed your assessment. Provide your nursing impression and let the patient know what will come next. Other physical assessments, follow-up appointment, any laboratory tests, etc.